Hello everyone and welcome to our presentation of diabetes in the Hispanic population in Wake County. This is presented by Lori Atkins, Grace Gilliam, Sherry Moss, Mary Armstrong, Brittany Purnell, and myself, Steve Jones. Alright, diabetes is a progressive disease in which the body does not make enough insulin and does not properly respond to that insulin. In Wake County alone, our Hispanic and Latino population consists of 10.3% of the total makeup within the county. Of those 10.3%, 12.1% have an affliction with diabetes. It's the seventh leading cause of death in North Carolina, and there were 6 diabetes-related Hispanic deaths in Wake County between 2009 and 2013. Our community assessment included a windshield survey where we looked at Raleigh as the closest city to the center of Wake County. It is also our capital. Surrounding it is the Research Triangle Park, which houses many outstanding colleges and universities, as well as our state capitol and other government buildings. There are 20 county subdivisions consisting of numerous culturally diverse housing developments and neighborhoods that are each individually named. Our housing and zoning consists of many buildings in the downtown area that are very old with metered street parking. More recently developed buildings have begun to spread out to the outer city limits and are in better shape and more structurally sound than what was previously built. Both single and multifamily dwellings exist. There were signs of decay that we noticed. Our upper middle class areas were very well maintained when compared to the lower class sections that showcase littered trash, graffitis on the buildings, old mattresses, lawnmowers, cars in the yards, things like that would drive down property values. There are over 29 parks in the Wake County area alone. They consist of ballparks, nature walk trails, water parks, golf courses, and children's playgrounds. There are many common areas for the Latino population to gather. There are also many grocery stores consisting of things like Food Lion, Harris Teeter, as well as more culturally diverse supermarkets like the El Toro supermarket, the La Potosina grocery, and the Mi Casa grocery store. People get around here by privately owned vehicles as well as public transportation provided by buses and taxis. There are handicap services available with the Wake County Human Services Wheelchair Transport Group. Also in our historic downtown districts, the roads need a little bit of improvement. We noticed that some of the roads are laid with brick and make them look nice but are not well maintained. Communication. This area we have 3 print newspapers, the News and Observer, the Wake Weekly, and the Southwest Wake News and Observer. Our local television stations consist of WRAL TV5 and ABC 11. There are also numerous billboards up and down Capitol Boulevard leading in and out of the city. 171 schools in the Wake County area alone. Different public centers that are within the county include Child Protective Services, the City of Raleigh Community Services, Consumer Rights, the Spanish-speaking crisis lines, Immigration Citizenship, Legal Aid of North Carolina, the Mexican Consulate, and the National Council of La Raza. Many chambers, different chambers in North Carolina include the Hispanic Chamber of Commerce and the North Carolina Society of Hispanic Professionals. There are also, all citizens here are serviced with the services provided by the Raleigh Police Department, our Latino Community Credit Union, the Employment Security Commission Office, as well as multiple child care services, Salvation Army, dental offices, physician and pediatrics offices, and hospitals. Most of the people seen in the community during the day were older and of retirement age. There were Hispanic women that were out and about, particularly in the Walmart that was observed. Most of the school-age children, though, however, were in school because of it being a weekday. From what we observed, it seemed to be more of a lower class to middle class people that were out, depending on which way you looked. Different industries. The Research Triangle Park's the largest industries are government, education, and healthcare. Major employers include Biogen IDEC, Bojangles, Cisco Systems, Food Lion, GlaxoSmithKline, the state of North Carolina, Rex Healthcare, Verizon, and Walmart. 29 fire stations employ 544 firefighters in the city of Raleigh alone. They protect 144.24 square miles and serve more than 440,000 residents. There are 504 law enforcement agencies employing over 23,000 sworn police officers, which calculates to be about 254 police officers per 100,000 residents. At this time, there's no evidence of any political activity in the area. However, Raleigh is the state capital, which in Wake County serves as a reliably blue state, otherwise known as Democrats. The population of Wake County is 60.5% white, 20% black, and 10% Hispanic. Over 16% of the people in Wake County speak a non-English language. 92% are U.S. citizens, with Hispanics and Latinos being the largest other represented ethnic group. Many stores, churches, and restaurants exist specific to the Hispanic and Latino population. You see some examples there. Religion. Catholicism is the primary religion that was observed. There are many private Christian schools, as well as Baptist and Church of Christ. We have several seminary schools in the area. The different denominations of the Hispanic churches include Methodist, the Church of God, and Catholicism, which I mentioned before. Hispanic Family Center is dedicated to empowering Hispanic families to become more integrated in the community and to improve their quality of life. Health and morbidity. Heart disease and cancer, the two leading causes of death among Hispanics. All right. Latinos also have death from kidney disease, which is a far greater number than in the white population. Cancers related to infections such as cervical, stomach, and liver are more common among Hispanics, especially if they were born in another country. Smoking among Hispanics, however, is less common than whites. Our informant interview consisted of an interview with Melissa Rafidi, an adult geriatric nurse practitioner specializing in endocrinology. Her role description and how long she had been in this role. She claims that she has worked as an outpatient endocrinology practice for about 4 months. Her job consists of a lot of education about lifestyle and diet when it comes to managing diabetes. The patient population consists of patients with endocrine problems. They get referred to them all the time from primary practice. About half of those folks referred are consistent with type 1 or type 2 diabetes. Half of those patients with type 1 or type 2 diabetes also have a variety of comorbid-related diabetes. They work with many insulin pumps and complex insulin regimens to control high blood sugars. Some of the biggest areas of knowledge deficit seen in these patients is simply not able to understand the basics of what diabetes is and how it affects their lifestyle. It is surprising to her that many of the patients don't understand the simple nutritional information necessary to sustain manageable blood sugars. A lot of these people think they're eating healthy, but they do not realize the amount of carbohydrates they're consuming on a day-to-day basis. Type of education that she recommends: every patient newly diagnosed with diabetes attend a formal group diabetes introduction course and another nutrition course. These appointments are usually only 20 minutes, so it's almost impossible to educate the patient to the extent that is required. Patients with similar diagnoses learn from each other's experiences and hopefully motivate one another to stay on the right course. Are there any other educational resources, we asked? Medicare and Medicaid, she explained, will pay for formal group diabetes education yearly with an improved educator that follows the American Association of Diabetes Education guidelines. Their practice, the appointment with the diabetes educator is set at the same day. They will not charge the patient for that education, of course. This in return encourages these patients to come attend their education sessions. Resources available that she recommends for any uninsured patient with diabetes: they recommend Walmart brand diabetes supplies. The Rely On are very inexpensive and can help with the getting strips as well as insulin and other necessary supplies. How can she go about accessing new resources? They suggest starting with the AADE website, and for food choices, the MyPlate method online, specific for diabetes. Risk factors that put the Latino population at greater risk. Well, the biggest thing is a lack of physical activity outside of work-related activity, coupled with a lower educational platform for understanding what the proper diet is necessary to make the healthy food choices needed. Teaching to give new diabetic patients when educating them, first thing they ask is that they drink a lot of sugary sodas or sweet tea. Down in the South, that is a big thing amongst all of us. One thing that they do recommend initially and immediately is to switch from the sugary sodas to the diet sodas and unsweet teas, just to see if they have a few pounds lost from that one change. Usually that change seen motivates them to continue to work harder at achieving their goals. They recommend that they get 150 minutes of moderate intensity activity weekly. They ask them to walk 30 minutes 3 times a day and slowly increase their intensity. All right. The primary thing that they do want to emphasize again is foot care to prevent diabetic foot infections and non-traumatic amputations. The Rely brand at Walmart is the first recommendation for patients who require insulin. That is, if people don't have access to health insurance and supplies for monitoring their blood glucose. She is quoted as saying, "I think diabetes walking groups are great for community exercising and encouraging each other. I don't know of any specifically, but know that they are out there from what her patients say." And that's where we were referring to patients who are required to be in the community to get with groups of people with like situations to encourage participation. All right, our secondary analysis. The July 2016 census for Wake County showed a population estimate of over 1,046,000. 68% of those were white, 21% were Black or African American, and Latinos consisting of about 10%. Medicare enrollees between the ages of 65 and 75 in Wake County for 2014 showed that they had treatments for their diabetes by having eye exams, hemoglobin tests, and lipid tests. Epidemiological statistics: diabetes is the 7th leading cause of death in Wake County for Wake County residents. As of 2014, biggest health issues and leading cause of death in Wake County were cancer, heart disease, cerebrovascular disease, all the way down to chronic lung, lower respiratory disease, and unintentional injury. Secondary analysis showed that homeowners occupying housing units were 93%, vacant housing units at 7%. Whites alone householders were 49%, with Hispanic and Latinos sharing at 2.7% of owner-occupied housing. Renter-occupied housing, Hispanics and Latinos showed a 3.8% there. Health insurance coverage. White health insurance coverage is 89.6%. 77% with private health insurance, 21% with public, and 10% with none at all. So our status, 2016, Wake County was ranked the healthiest county in North Carolina. It's a very structured county. They conduct community health needs assessments every 3 years to identify areas of need within. This info is gathered from collaborative inputs, and the process assessment data includes statistical data, input from community organization surveys, and focus groups. Community diagnosis includes uncontrolled blood sugar, which can result in diabetic ketoacidosis, cardiovascular disease, which is also an identifiable health risk for the Hispanic community, foot damage, non-healing wounds, and neuropathy. Our strengths: access to grocery stores for healthy food, diabetic support groups, and A1C and blood sugar screenings. Weaknesses and language barriers, food choices, and lack of access to the healthcare and medications needed. Our community diagnosis, we concluded that a risk of complications associated with type 2 diabetes among the Hispanic population of Wake County, North Carolina, related to inadequate education and access to health care, is evidenced by fasting blood sugar greater than 125 milligrams per deciliter on 2 separate tests, the A1C level of 6.5 or higher on 2 separate tests, non-healing wounds and sores, and oral glucose tolerance test of 200 milligrams per deciliter 2 hours after administration. Our interventions include primary, our diabetic diet education classes. We want to encourage proper food choices, timing of meals, carb counting, and water intake. Our measured outcomes would be to maintain or achieve a healthy BMI and to maintain or achieve an A1C less than 6. Our A1 screening, we want to screen those individuals that we have known risk factors for. Outcomes identify persons with elevated A1Cs and provide further counseling and treatments. Our foot health and foot care education classes. For people identified as being diabetic and at greater risk for foot health issues, we promote grooming, self-checks, and when to seek medical care. Measurable outcomes include achieving and maintaining foot health. We want to assess for signs and symptoms of hyperglycemia. Education is a key. Assess their vital signs to note color and sensation of affected feet, and assess a patient's knowledge of their diets. Our conclusion: cultural beliefs should be taken into consideration when selecting adequate treatments. Patient education and disease management should be individualized. We should include patient family members in the care model where appropriate, and we should assess and include patient eating practices, preferences, and food prep for long-term dietary lifestyle changes. These are a list of our references here. We hope that you have enjoyed our presentation on diabetes in the Latino community in Wake County, North Carolina. Please feel free to reach out to anyone in our group if you have any questions. Thank you very much.